Hi there, I'm Eitan. I'm one of the orthopedic surgery residents here at MGH. I'm here with Vanessa Delaheim. She's one of our esteemed physical therapists. We're going to have a conversation today about physical therapy while you're in the hospital after orthopedic surgery. Hi, Vanessa.
Hi. Hi.
Do you want to tell our patients a little bit about the different weight bearing and range of motion restrictions that they might have after surgery?
Sure. So depending on the surgery that you have, you could have multiple different types of weight bearing. So weight bearing is tolerated means you can weight bear, you can put as much weight through that limb as your pain allows. Partial weight bearing means you can put about 50% of your weight through that affected limb. Touchdown weight bearing means you really just want your foot or toe touching the ground but no weight going through it. And then non-weight bearing is no weight going through that leg. So you either have to hop or find some device that will work with you on to prevent putting weight through that limb.
Perfect. And do you think that different surgeries that you've seen tend to lead to different kinds of weight bearing statuses?
Yep, so different surgeries will depend on the weight bearing, and your bone quality is another one, and ultimately we go by what the surgeon recommends.
Perfect. One other question that we were going to address was when physical therapy will work with you in the hospital.
So that too sort of depends. It depends on what type of surgery you have, how you're recovering after surgery, and then if your plan will ultimately be home or rehab. Typically we see you the day after surgery or the second day after surgery once you're ready for us.
So one other thing we were going to discuss was the different types of assistive devices that you might give patients while they're in the hospital.
Mm-hmm. So the most common assistive device that we'll use is a rolling walker, and we'll teach you how to walk with it with whatever weight bearing status that you have. The second most common is crutches, and again we'll train you during your PT eval and treatments on the best way to use them, and we'll also figure out which one is the safest for you to use to maintain your weight bearing and make sure you can go home if possible, or if you aren't able to use them and maintain your weight bearing, then we may recommend rehab. The last is a cane. That's probably the least used here, but it's also it's a possibility.
Awesome. Can you tell us a little bit about yourself and what you love most about being a physical therapist?
Sure. So I'm the clinical specialist for orthopedics, and I love helping people achieve their goals and get home or achieve getting back to recreation or whatever you enjoy doing for your hobbies, and that's what we all try to do here.
Great. Well, it's really nice talking to you.
You
Thanks
too.
for taking the time. And from all of us here at MGH, we wish you a speedy recovery.